Hello. Well, this is exciting. This is me trying to live stream on YouTube, something I have never ever attempted to do before. Um, not quite sure how it'll go, but let's give it a whirl. Um, am I expecting loads of people to come in? Probably not, because I'm not well enough known. But I hope that people who see the video afterwards may think that what I do is interesting enough they'd like to follow me. Maybe next time there will be some more people in. I am used to live streaming because I live stream a lot on Twitch. I have a Twitch channel where I talk about um, lots of things, mainly Tai Chi, Qigong and mindfulness. Excuse me, go and drink a cup of coffee. Oops, the world runs better with coffee. So, for the benefit of anybody who doesn't know who I am, my name is Sally, and I used to be a pharmacist, and I am now qualified in a number of different holistic and complementary therapies. The two I use most are Tai Chi, Qigong, and mindfulness, but I'm also a qualified hypnotherapist. And I'm happy to show all my certificates if anyone wants to see them. I've got qualifications, I've got insurance. And I stream because I know there are lots of people out there who need help. And I'm hoping that, every stream will reach at least one person who will benefit from it. So today I want to talk about pain management, and this is something that's been specifically requested. So here we go. I think we all know what pain is. Or at least we all know what our pain is. Because pain is very subjective. It's almost impossible to be objective about pain. Back in the days when I was a pharmacist working on the pain team in hospital, we used to have a little analog scale, what we called a pain score, with different facial expressions for people who, couldn't really read or weren't numerate. Basically, it ranged from 0 to 10, where 0 was no pain and 10 was the worst pain you could imagine. But a level of pain that one person would say was a 10, somebody else might be a 5. So pain is very, very subjective. You are the one that understands what your pain is, where you're feeling it, and how it's affecting you. And you are the only one that can do anything about it. Excuse me. Now, there are a number of different things that you can do about it. First thing is, you can take analgesic drugs. These are a perfectly acceptable option. And certainly for acute pain, drugs like paracetamol, non-steroidal anti-inflammatories, even the weaker opioids can be extremely effective. When you've got chronic pain, though, it's a little bit different because sadly, all the evidence shows that if you've got chronic pain, drugs become much less effective. Now, this doesn't mean that you are doomed to suffer horrible pain all the time. Because drugs are only one way of breaking the link between the area that's causing you pain and the pain sensors in your brain. Because the bottom line is, until you get a signal going through to a pain sensor, whether it's in the brain or indeed whether it's in the periphery, you're not going to go, ouch. Now, of all the things that Western medicine treats, pain is probably the one that sits most closely at the mind-body interface. Because there is a huge mental component to pain. I've already explained that a bit by saying that, your perception of pain is very individual. But if you have pain, it will probably cause you to become slightly low in mood. You might almost say depressed. But the same thing goes the other way. If you are tired and depressed, your pain can feel much worse. So there is a very, very strong mental component to your perception of your pain. And there are some very, very helpful techniques that you can use to help manage those. Now, the person for whom I'm doing this video, I know really enjoys mindfulness meditation, so I'm going to start there. Because mindfulness meditation, or just, now let's miss the word meditation, mindfulness is the awareness of what's going on right here, right now. And you might think that if what's going on right here, right now is pain, the last thing you want to do is focus on it. But when you have pain, it's natural to push back against it. You don't want it, you reject it. And actually, that causes tension, which can actually make the pain worse. So mindfulness is an invitation to really explore what the pain is and where it is and what's really going on. So if you have chronic pain, I'm going to invite you now just to sit down, take a few moments to be quiet. And I'm going to invite you, if you feel safe, to close your eyes. And I want you to just bring your attention to your breathing. And as you focus on your breath, I want you to practice letting go any thoughts that come in. Be aware of them, but try not to get caught up in them. Now, as you sit there, you may be aware of sounds, you may be aware of smells, you may be aware of sensations in or on your body. But what I'd like you to do is, with anything that comes up, can you notice it, but not get caught up in it? Letting go of the need to identify or classify whatever you are feeling or seeing or hearing or smelling right here, right now. And the invitation to focus on your breathing is a very common one in mindfulness, but it's a very helpful one Because as you focus on your breath, you can allow your awareness of your breath to anchor you into this moment when nothing else matters except just this breath coming in, just this breath going out. And noticing that whatever comes in to try to distract you, it will change or it will stop because nothing lasts forever. So as you practice focusing on your breathing, practicing letting go, practicing not giving an emotional content to anything that you sense, I would like to invite you to do a quick scan of your whole body with your attention. And I'd like you to notice any areas of your body that are sending you signals, whether it's pain or cramp or a bit of discomfort. I want you to notice what those signals are. Maybe you can try adjusting your position to make yourself a little more comfortable. That's okay. But maybe you're aware of the sort of pain that you can't really adjust your position for. And it's screaming at you for attention. What I would like to invite you to do is to give your full attention to that part of your body that is sending the signal. And I'd like you to pay attention to it with a kind of detached curiosity. Because I want to invite you to really see, really get a sense of exactly what is going on in the area that's sending you this loud signal. Can you pinpoint the center of the sensation and pain? Can you locate the edge? Where does it stop? Is the pain constant? Is it one solid block? Or does it rise and fall in intensity? So many things that you could maybe become aware of when you truly examine your pain. And what you discover when you really pay attention to that area may surprise you. Because when you pay attention to a particular part of your body, you naturally tend to relax it. And very often, a lot of pain is caused by tension, by muscles tensing. So that relaxation may in itself cause the pain to lessen. You may discover that the area isn't quite as big as you thought it was. But one of the biggest causes of distress when you have pain is the feeling of not being able to control it. having no power over it. And actually, the only thing you have power over is your thoughts. So I'm going to invite you to use your thoughts and your imagination in a very specific way. I would like you to imagine that every time you breathe in, you're breathing in healing energy from the universe around you. And with your next in breath, I would like you to imagine that you breathe down deeply into the area that is causing you pain. Visualize that healing energy being sent to that part of your body. Maybe imagine your breath massaging the painful area from the inside. And as you do, imagine that massaging breath helping to spread the healing and infuse the healing deeply into the area of pain. And then, when you're ready, open your eyes and bring yourself back to normal awareness. Now, that's a technique that will work well for anyone who is quite practiced in mindfulness. And I know there's lots of people out there who are quite well practiced in mindfulness these days. So, what if you're not practiced in mindfulness? Well, I hope you still joined in, because practicing mindfulness is something that has benefits for many, many reasons. But I'd like to try another visual technique with you that can maybe help you gain a certain amount of control, or enable you to feel you have a certain amount of control over your pain. I would like you to give your pain a shape and a colour. What shape and colour does your pain feel? What does the word pain get you to visualize when you know, in terms of a shape and a colour? Red spiky balls are quite common. But any colour and any shape that resonates with you is perfect, because there's no right or wrong answer. If you've got chronic pain, it's probably all too easy to visualize what your chronic pain, what colour it is, and what shape you associate with it. But I'm now going to ask you to imagine the absence of pain and to give that a different shape and a different colour. That may be a bit harder for you, but your imagination is incredibly powerful. And when you've got the two images fixed in your mind, what I'd like to invite you to do is to imagine the pain, shape, and colour changing into the no pain, shape, or colour. Now, maybe it's a gradual change, maybe it's a sudden change, I don't know. However it works for you, give it a go. And because of the strange way our brains work, when you feel the pain, if you imagine that pain as a shape and a colour, and then change it to your no pain shape and colour, that can sometimes have very surprising effects. But there is another reason why mindfulness is actually a really, really good technique for somebody with chronic pain. And this is why the core of my work on Twitch is mindfulness. Because I think mindfulness is such a wonderful technique that everyone needs to practice every day. See, the thing with mindfulness is you're focusing on what is happening right here, right now. And if you have chronic pain, and I know this because been there, done that, got the t-shirt, had the surgery to correct it, a lot of pain isn't caused by what you're doing now. But what happens is you're thinking ahead, you're thinking, oh, what's going to happen when I stand up, when I take that next step. You are anticipating the pain and you are tensing against the pain. And that just makes everything worse. And what mindfulness does, by helping you focus on what's happening in each breath, what's happening in each moment, is you only deal with the pain as it is right now. You're not running ahead, trying to think how you're going to cope in future. You're coping with the only thing you can do, which is cope with what's in front of you, right here, right now. Now, if the pain is kind of on the surface, then there are other things that you can do. Simply rubbing it, massaging a painful area does work. There are physiological reasons why it works, but it does help. So literally massaging the area, even if it's not quite on the surface, it's just inside, you can massage it. And if you massage it with the intention of relaxing the area, helping it to feel better, then again, that can have surprisingly good results. Now, the wonderful thing is that absolutely none of these techniques interfere with any drugs. You can continue to take your normal medication. The advantage of my efforts is they're free. You can do it yourself. You haven't got to wait for anybody to provide you with anything or do anything to you. You can do it yourself. Because it's always possible to focus on your breath and to bring your focus close into the painful area, to relax it, to imagine healing going into it. Because one of the horrible things about pain is the feeling that you're not in control, that you've got absolutely no control over the pain. As I said earlier, the only thing you have any control over is your thoughts. And because pain sits so closely at the mind-body interface, controlling your thoughts, using them in a proactive, intentional way can have greater benefits than you might think. So I hope you found some of this useful. As I say, I do most of my stuff on Twitch. Can I put stuff into chat? Yes, I think I can. Engage with your audience. There we are. I'm learning how this works. I just want to chat. No, evidently I can't post into chat unless top chat. Where can I chat? Live chat. Where can I chat? I can't see anywhere to type into chat apart from starting a poll or starting a Q&A, neither of which are really appropriate. Oh, hold on. Learn more. Oh, God. Don't know what I've done there. Okay. I will put something in the comments under the video as to where you can find my Twitch, where you can find my Discord, and where you can find my Patreon, which are other ways that you can engage with me. Anyway, I hope this has been helpful. I'm not quite sure when I'll be live streaming either on here or Twitch again, but oh, sorry, if you can hear a cat's just wandered in. Nearly time to end the stream anyway. So thank you for watching the video, and I'll put in comments under the video where you can find other bits of my work. Take care. Bye-bye.